A mental health counselor (MHC) or counselor is a person who uses psychotherapeutic methods to help others. The legal definition of a counselor, and hence the legal scope of practice, varies with jurisdiction. In some jurisdictions across the United States, counselors, marriage and family therapists, and psychologists have virtually identical definitions, evaluating and treating mental and behavioral disorders. In spite of such definitions, many mental health professionals reject the medical model, which assumes that clients are disordered, in favor of broader viewpoints, such as those that emerged from systems psychology. MHCs work with individuals, couples, families, and groups to address and treat emotional and mental disorders and to promote mental health. Most mental health counselors in the U.S. work in outpatient and residential care centers, individual and family services, and local governments. They are trained in a variety of therapeutic techniques used to address issues, including depression, anxiety, addiction and substance abuse, suicidal impulses, stress, problems with self-esteem, and grief. They also help with job and career concerns, educational decisions, issues related to mental and emotional health, and family, parenting, marital, or other relationship problems. MHCs also continue to play a growing role in the military mental health crisis, helping military personnel and their families deal with issues such as PTSD. MHCs often work closely with other mental health specialists, such as psychiatrists, psychologists, clinical social workers, psychiatric nurses, and school counselors. In the U.S. states, MHCs diagnose as well as treat mental illness, though the scope of practice for mental health practitioners varies from state to state. Licensing requirements depending on political division. In all states, mental health counseling licensure is required to independently practice, but can be practiced without a license if under close supervision of a licensed practitioner. Licensing titles for mental health counselors vary from state to state. Licensed mental health counselor (LMHC), licensed professional counselor (LPC), licensed professional clinical counselor (LPCC), and various forms of these titles may list differently per state statutes. The title mental health counselor, or variation thereof, is often a protected title, and thus it may be a violation of state law for persons to hold themselves as such without a proper credential. A licensed mental health counselor holds a minimum of a master's degree in counseling or another closely related field in mental health care. After obtaining a master's degree, mental health counselors complete 2 to 3 years, depending on various state statutes, of clinical work under the supervision of a licensed or certified mental health professional. The qualifications for licensure are similar to those for marriage and family therapists and for clinical social workers.